नमस्कार, गुड मॉर्निंग। मैं डॉक्टर अचल गुप्ता हूँ, कंसल्टेंट न्यूरोसर्जन एंड एंडोस्कोपिक स्पाइन सर्जन एट सेंट जोसेफ हॉस्पिटल एंड न्यूरोन ब्रेन एंड स्पाइन सेंटर, गोमती नगर, विभूति खंड, लखनऊ. So today we will discuss regarding the epilepsy on International Epilepsy Day. Today is second Monday of this February, and on every second Monday of the February every year we celebrate International Epilepsy Day. It was first started by or proposed by International League Against Epilepsy, and they recommended to WHO. WHO readily accepted this day and they started celebrating the International Epilepsy Day. The motto of celebrating the International Epilepsy Day was make the people aware regarding this condition, to make the people know that this condition is treatable, to know the people regarding that this disease is not communicable. This is non-communicable disease. This is treatable condition, and everyone should not feel like this is a social stigma. They should come forward and tell their stories, aware everyone, and go ahead with the proper treatment so that the patient can be treated and cured. So what are the treatment options for the epilepsy? Treatment options in the epilepsy remain mainly the medical management, like anti-epileptic drugs. So apart from the medicines, your doctor can advise for surgery if the patient falls in that criteria, or vagus nerve stimulation and the ketogenic diet. These are the major treatment protocols which are there to treat the epilepsy. So most of the patient just remain free of the epilepsy just with the medicines. Few patients require the surgery and very few require the vagus nerve stimulation. So these are the ways in which we can control the epilepsy. Now on the International Epilepsy Day, I want to share that the color of epilepsy is the purple, so which is the designated color. And so now let's share some of the experiences of the celebrities with epilepsy. So you know the John T. Rhodes. John T. Rhodes is a famous South African cricketer, and he had epilepsy, but he was able to manage with the self-discipline, proper medications, and he was absolutely all right with epilepsy. So similarly, Alfred Nobel, he was also having the epilepsy, on whose name we distribute the Nobel Prize. So there are many celebrities who had epilepsy. They led normal life and they were absolutely okay. So the key thing is you have to remain in discipline. You have to follow your doctor's advice regarding the medications, and you can be free from the epilepsy. Believe me, this is not a stigma. This is treatable condition. This is non-communicable, and if you follow the advice of doctor, you will be all right. What are the general things that you can do to prevent the epilepsy? So to prevent epilepsy, you should sleep at right point of time, like maybe 10 o'clock in the night or 11 o'clock. You should sleep for 7 to 8 hours. You should maintain this habit regularly and continuously. You should not be like this. Today you are sleeping at 10 o'clock, next day you are sleeping at 12 o'clock midnight, next day you are sleeping again at 8 o'clock. So this should not be followed. You should be in discipline regarding your sleep. You should sleep once for 7 to 8 hours in one single go. You should not be like that, 3 hours or 4 hours sleep, then 2 hours in the morning. No, you should not complete this way. You have to have one single set of good sleep of 7 to 8 hours. That is the key point. Next, you get up early in the morning, and you do some pranayam, some exercises, light exercises, freshen up your body, take proper meals, do not skip any meals, take breakfast, take lunch and dinner at their proper interval of time, take some light diet in between the breakfast and lunch and dinner, something in between, and don't forget to take your medicines. We usually say you can forget your food, but you cannot forget the medicines. So you should not forget the medicines at any cost. Take in the morning, take in the evening properly, and you should not skip any of the medication. In case you have forgotten, as soon as you remember, take the medicine. So don't forget to take the medicine. So next is the screen time. So we generally prefer that you should not use the mobile phone, laptop, desktop, TV more than 2 to 3 hours in a month. But if your profession is like this, so make sure you should get ample break in between, and you should not be working in the dark room, which can cause the flashes of the light and can increase the epilepsy or the fits. If your profession is like this, so you might need to change your profession. So these are the few tips. If you follow, then you can be free from the epilepsy or the seizures disorder. Thank you.